So this is really an outstanding session, and I'm really very happy to make the lay abstract for each speaker. And first of all, Dr. Lima Cunha just explained about induced pluripotent stem cells that she works a long time ago, since 15 years. And so she just explained that it's a long differentiation of these iPS stem cells, and that can be also an organoid. The point is to generate the stem cells and from skins, and from the skin, then there is 4 weeks to wait about the development, and then pick up these stem cells and expand them. And it's very interesting to have an early cells, an early eye development. But they can be both retina and also, of course, corneal cells. The problem about that is sometimes there is mislocation of the stem cells. So there is different models about these epithelial stem cells, and with a decrease in PAX6 in aniridia when you compare to wild type. And these models are really interesting, and could be also very interesting in the development of organoids. So these models, modeling and drug screening for nonsense mutation can be very interesting, and also could be interesting in new tissues like lens. The second talk was David Price, and it was really very, very interesting in the role of PAX6 in brain. And so he just explained that there is an ability of developing cells to respond to environment thanks to PAX6. So PAX6 really respond to signals from optic vesicle. And in cerebral cortex, it's really a different way, because there is two kinds of neurons: excitatory neurons and inhibitory neurons. And for excited neurons, PAX6 is present in every cell. But for inhibitory, there is no PAX6 in cells. And so when you have wild type, there is no problem, but when there is knockout, there is more inhibitory neurons, because some cells switches to inhibitory. But in another way, most of the cells in knockout develop normally. So PAX6 indeed is not needed for most of cells to develop normally, but for some others, it's needed, and they develop in inhibitory. So some cells may have the low ability to respond, and also PAX6 loss could be increasing sensitivity of cortical cells to sonic hedgehog. And so I think if I understand well, PAX6 protects cells, decreasing the likelihood that brain cells will develop abnormally. So if we understand that, there is solution to be And the last talk is from Daniel Abadam, a friend, because we work together. And he just explained about stem cell deficiency or failure just lead to what we call in clinic aniridia-related keratopathy. And so to fight against this failure or deficiency of stem cells, there is repurposing of some medications, and two drugs appear really very interesting, like duloxetine or ritonserin, and both have shown very interesting effects. So duloxetine inactivates dopamine, and ritanserin blocks dopamine and is also antagonist of serotonin. So in both cases, PAX6 is activated and through NEK or ERK signaling pathways activation. And so there is a possibility to test the molecules and to have some possibility to increase PAX6.